My name is Madison Vanlandingham. I'm going to be presenting my program evaluation for implementation of a transportation program at the Ridge Behavioral Health Facility for mentally ill patients who lack financial supports and social supports. So, like I said, the need is for transportation. The Ridge is limited in the kind of transportation it offers currently. Right now, it only offers like bus fare, and it'll like arrange transportation with like outside programs like sober living houses and stuff if they have transportation programs, or if they have transportation. But other than that, like unless you have somebody to come get you, you're walking essentially, or if your insurance will cover it. So those who lack social support or financial resources struggle to get to and from, whether it be to appointments after. So like once they're discharged isn't the only problem. It's getting to aftercare appointments to continue therapy or to continue medication management. And pretty much as soon as you're discharged from the Ridge, like that's the end of their help in terms of transportation, like bus fare. And if that's all they give you, that's all they give you. You're on your own to figure out how to get to appointment. According to Harandi, social support reduces the negative effects of mental stress in 5 ways: emotional attention, helping, information assessment of others' feedback about the quality of performance and social ability. Individuals with severe mental illness are at an increased risk for these negative effects, which in turn leads to a lack of reliable assistance. In addition to providing transportation at discharge, the service will provide patients with transport to appointments such as therapy and medication management. So that's the idea of the program. The Health and Research and Educational Trust identified implementing door-to-door shuttle services for patients as a strategy for hospitals to address transportation issues for patients. The idea is that if the Ridge implemented a transportation program, then rates of compliance and aftercare appointments would increase and rates of rehospitalizations would decrease. According to the Substance Abuse and Mental Health Services Administration, rehospitalization within 30 days of Kentucky is 6.2%, and within 180 days is 19.3%. What happens a lot of times is patients get admitted to the Ridge, they get back on medication, they leave because they've either stopped feeling suicidal or their delusions or hallucinations or whatever the mental illness they're struggling with or symptoms they're struggling with get better. And so they are discharged, but then they have no way to get to those appointments, to continue those medications, and to continue therapy. And without that, like if you don't go to your appointments, you're not going to get the prescription. So the van service would help with this. There are other hospitals currently that already do this. Calvert Medical Center has a mobile health center. Denver Medical Center partners with Lyft. Grace Cottage Family and Health Hospital partners with a volunteer driver program. And Taylor Regional Hospital created their own hospitality van service for its patients. So it's something that has been done before and has proved helpful for patients in need. So evaluation and research design for this program. So because it is a comparison of numbers of before and after, quantitative research is the most appropriate form to use. In addition to this, we'll use correlational research because it is a form of research where 2 variables are assessed in terms of their statistical relationship, where the researcher is not interfering with any of the variables. In this case, the researcher is not able to interfere or force or manipulate the independent variable, which would be the frequency of which the patient uses the transportation service. And the service only runs if there's an appointment schedule and it is confirmed. We cannot ethically manipulate the rate at which the patients use the program to attend their appointments. However, we can observe when they do and don't use it to compare to prior data of attendance through the use of the archival data. So that we'll use archival data to study for comparison. The study would be a positive correlation research study, as the 2 factors in theory are going to positively influence one another. So creating the transportation service would increase the rate of compliance. So it would be a positive correlation. Because the program is centralized at the Ridge, which primarily only serves Kentucky residents, widespread sampling is not possible. So therefore, we would use random cluster samples of patients within the program. It's within the Ridge, which there'd be different criteria that would be determined by the discharge planner based on demographics, economic status, stuff like that. And then they would be put into the database and randomly selected from there. The reasoning behind this type of sample is the criterion identified as not to violate the patient privacy and confidentiality. So that's another reason that it's helpful, is because it is a hospital setting, so HIPAA. Because using a transportation program and attending appointments and voluntary rehospitalization are all behaviors, behavioral outcomes would be the most appropriate measure for this program evaluation. These are the same behaviors, not something that can be measured with interviews or questionnaires or any standard of measurement of analysis. Evaluation of the project would be done using external evaluators, again, HIPAA, and because it doesn't need to be face-to-face, it would be somebody looking at data from outside the facility, meaning it would be unbiased, more valid, more reliable. Data for this program will be measured at the 3-month, 6-month, and 1-year mark. And overall, the program's success will be determined at the 1-year mark after reviewing the progress or lack of progress tracked by the data over the year's time at the different specified increments that I just mentioned. So in order to continue to validate this program, it is necessary, review of the data may be needed to be redone and reviewed every 3 to 5 years. Thank you.